Don't stop. Don't stop. Don't stop. Don't stop. Don't.
Glossary, Abducens nerve. Sixth cranial nerve. Abduction. A motion that moves a structure away from the body center line. Accessory bone. A bone formed when ossification centers fail to unite during development. Accessory nerve. 11th cranial nerve. Adam's apple. Laryngeal prominence. A prominent protuberance of the thyroid cartilage in the anterior midline of the neck, especially in adult males. Adduction. A motion that moves a structure closer to the body center line. Adenoids. Hypertrophy of the pharyngeal tonsil as a result of infection. Aditus. An opening or inlet. AWerent. Leading toward a specific area, as toward the central nervous system or a lymph node. Agonists. Muscles whose contractions produce a desired motion. Alveolar arch bony portions on the maxillae and mandible that surround the teeth. Alveolus. A small cavity. The socket of a tooth. Anastomosis. Direct communication between blood vessels and between nerves. Anatomy. The science of the structure of the body. Anesthesia. Loss of sensation as a result of injury, disease, or induction by drugs. Ankyloglossia. Tongue-tied. The lingual frenulum is attached too far anteriorly on the tongue, impeding speech. Anomaly. Deviation from the normal. Ansa cervicalis. Nerve loop derived from C1, C2, and C3 to supply the infrahyoid muscles. Ansa subclavia. Loop around the subclavian artery connecting the middle and inferior cervical sympathetic ganglia. Antagonists. Muscles that act in opposition to agonists. Anterior. Front of the body. Anterior triangle, i.e. triangular area of the neck bounded by the sternocleidomastoid muscle, the anterior midline of the neck, and the inferior border of the mandible. Aponeurosis. A flat, sheet-like tendinous muscle attachment. Appendicular skeleton. Bony skeleton composed of the bones comprising the superior and inferior extremities. Arachnoid. Intermediate layer of the meninges covering the brain and spinal cord. Arachnoid granulations. Modified elements of the arachnoid that filter cerebrospinal fluid from the subarachnoid space into the lacunae lateralis. Arrector pili. Involuntary smooth muscles arising in the dermis and inserting into the hair follicle. Contractions produce goosebumps. Articular disc. Meniscus. The disc intervening between the mandibular condyle and the temporal bone. Atlas. First cervical vertebra. Articulates with the occipital bone of the skull. Auditory tube. Eustachian tube. Opening of the middle ear cavity into the pharynx. Autonomic nervous system. A functional system controlling cardiac and smooth muscles and glandular activity. Axial skeleton. Bony skeleton composed of the skull, vertebral column, hyoid bone, ribs, and sternum. Axis. The second cervical vertebra. Basal ganglia. Subcortical nuclei associated with somatic motor functions. Blind spot. Optic disc. The light and sensitive region of the retina where the optic nerve exits the bulb of the eye. Blood-brain barrier. P-alglial elements surrounding blood vessels of the central nervous system that control the entry of materials into the intercellular spaces of the central nervous system. Bolus. A masticated, chewed, chunk of food ready for deglutition, swallowing. Bony depressions. Intervals between bony elevations. Descriptions include pits, foveae, and fossae. Bony elevations. Sites of attachment of structures to bone. Descriptions include lines, crests, ridges, processes, tubercles, tuberosities, and spines. Brachial plexus. Plexus of nerves formed by the ventral primary rami of CS, C6, C7, C8, and T1, with contributions from C4 and T2. Brainstem. The oldest part of the central nervous system, mainly responsible for vital functions. Bronchial arches. Pharyngeal arches. Bronchial grooves. Pharyngeal clefts. Buccal glands. Minor salivary glands located in the mucosa of the buccal vestibule. Buccopharyngeal fascia. Posterior lamina of the pretracheal fascia. Bursae. Fluid-filled sacs overlying joints, functioning in lubrication. Canal. A passageway or tunnel in bone. Cardiac muscle. Heart muscle. A special striated involuntary muscle. Carotid body. Structure located at the bifurcation of the common carotid artery to monitor oxygen tension and carbon dioxide in the bloodstream. Carotid plexus. Postganglionic sympathetic fibers derived from the superior cervical ganglion, traveling on the internal carotid artery. Carotid sheath. Facial sheath, derived from the deep cervical fascia, enveloping the major neurovascular bundle of the neck. Carotid sinus. Structure located in the wall of the internal carotid artery at its beginning, monitoring blood pressure. Carotid triangle. One of the subdivisions of the anterior triangle of the neck, bounded by the posterior belly of the digastric, the superior belly of the omohyoid, and the sternocleidomastoid muscles. Cartilaginous joint. A bony union or joint with cartilage interposed between the bones. Caudal. Inferior. Toward the tail. Cavernous sinus. A large, labyrinthine dural venous sinus located lateral to the sella turcica. Central nervous system. CNS. Composed of the brain and spinal cord. Cephalic. Rostral. Toward the rostral, head, end of the organism. Cerebellum. Portion of the brain derived from the metencephalon. Responsible for balance and spatial orientation. Cerebral arterial circle. Circle of Willis. Arterial anastomosis around the base of the brain. Cerebral hemispheres. Largest portion of the brain, derived from the prosencephalon. Cerebrospinal fluid. CFS. A clear, colorless, acellular fluid produced by the choroid plexus. Circulates in the ventricles of the brain, the central canal of the spinal cord, and the subarachnoid space. Cervical plexus. Plexus of nerves formed by the ventral primary rami of C1, C2, C3, C4, and, sometimes, C5. Cervical sympathetic trunk. Cervical continuation of the thoracic sympathetic trunk. Chain ganglia. Sympathetic ganglia located along the vertebral column. Choanae. Apertures of the nasal cavities opening into the nasopharynx. Choroid plexus. Modified pial/ependymal elements located in the ventricles of the brain that function to elaborate cerebrospinal fluid. Ciliary body. A portion of the middle coat of the eye, including the ciliary muscle and ciliary process. Circle of Willis. Cerebral arterial circle. Collateral ganglia. Sympathetic ganglia located away from the vertebral column, usually near the viscera, along major blood vessels. Computed tomography. A radiographic procedure whereby cross-sectional images of the body are visualized. Conchae. Turbinate bones. 3 mucosa-covered, scroll-like bones on the lateral nasal wall that jut into the nasal fossa. Condyle. The rounded articular end of a bone. Cones. Light-sensitive cells of the retina specialized for color vision. Confluence of sinuses. A region of dural sinuses, located at the internal occipital crest, receiving several major venous sinuses of the dura mater. Cornea. Anteriorly placed, modified, transparent portion of the sclera of the eye. Coronal plane. Frontal plane. A vertical plane at right angles to the sagittal plane. Coronal suture. A skull suture located in the frontal plane, from temple to temple. Cranial. Superior. In the direction of the head, craniad. Cranial fossa. A deep depression in the internal base of the skull consisting of three regions, anterior, middle, and posterior. Cranial outflow. Parasympathetic outflow from the brain in cranial nerves 3, 7, 9, and X craniosacral outflow. The combined parasympathetic outflow regions of origin for the entire body. Crenated tongue. Indentations along the lateral margins of the tongue indicating impressions from the teeth. Cricothyrotomy. A relatively safe emergency procedure for opening the airway by incising the cricothyroid membrane to relieve dyspnea. Deep. Relative position from the surface of the body from any direction. Deep cervical lymph nodes. Chain of lymph nodes following the carotid sheath. These ultimately receive all of the lymph from the head and neck. Deep fascia. Connective tissue sheath surrounding and compartmentalizing many of the structures of the body, including the muscles. Deglutition. The act of swallowing. Dendrite. One of the cell processes of a neuron that conducts impulses toward the cell body. Depress. To pull down or lower. Dermal papillae. Projections of the dermis that interdigitate with epidermal pegs at the epidermis-dermis interface. Dermis. Deep layer of the skin beneath the epidermis. Developmental anatomy. The study of the growth and development of an organism from conception to birth. Diaphragma cella. An incomplete covering composed of meningeal dura that acts as a membraneous lid over the cella turcica. Diencephalon. Rostral most portion of the brain stem. Diploic veins. Veins traveling in and draining the diplo of the skull. Distal. One away from the origin. Term used in describing relative positions of the teeth. Away from the midline anteriorly. Dorsal. Equal to posterior but usually reserved for quadrupeds. Dorsal horn. Gray matter of spinal cord containing cell bodies receiving sensory axons from the dorsal root. Dorsal root. Sensory root carrying axons from dorsal root ganglion to the spinal cord. Dorsal root ganglion. Sensory ganglion located on the dorsal root of each spinal nerve. Duct of Bartholin. Large sublingual duct of the sublingual gland opening very near or with the submandibular duct at the sublingual caruncula. Ducts of Rivenus. Small sublingual ducts of the sublingual gland opening along the surface of the plica sublingualis below the tongue. Dura mater. The outer layer of the meninges covering the brain and spinal cord. Efferent. Leading away from a specific area, as away from the central nervous system or a lymph node. Elastic cartilage. Type of cartilage located in the external ear, auditory tube, epiglottis, and parts of the larynx. Elevate. To lift up. Emissary veins. Veins originating on the scalp, then emptying into the dural venous sinuses through like-named foramina in the skull. Endochondral bone formation. Type of bone development on a cardi 1 agenus temp 1/8. Epidermal pegs. Projections of the epidermis that interdigitate with the dermal papillae at the epidermis-dermis interface. Epidermis. Surface layer of the skin. Epiglottis. An unpaired, leaf-shaped piece of elastic cartilage of the larynx projecting above and anterior to the superior laryngeal aperture. Eustachian tube. Auditory tube. Extension. A motion that increases the joint angle. External. Away from the center of the body. External acoustic meatus. Opening in the temporal bone leading into the middle ear. Extrinsic muscles of the eye. Muscles attached to and responsible for movement of the eyeball. Extrinsic muscles of the tongue. Musc1es that originate outside the tongue but inserting into it, thus making the tongue a highly movable structure. Facial nerve. Seventh cranial nerve. Falx cerebelli. Meningeal reflection of the dura mater, on the caudal surface of the tentorium cerebelli, intervening between the two cerebellar hemispheres. Falx cerebri. Sickle-shaped meningeal reflection of the dura mater intervening between the right and left cerebral hemispheres. Fascia. Collagenous connective tissue that encloses structures and separates them into various groups. Fibrocartilage. Type of cartilage in intervertebral discs, pubic symphysis, and mandibular symphysis, as well as on certain regions of the temporomandibular joint. Fibrous joint. A bony joint connected by fibrous connective tissue. Fissured tongue. Excessive fissures in the dorsum of the tongue. Fixators. Muscles that act to stabilize a structure. Flexion. A motion that reduces the joint angle. Foramen. An opening or hole in bone, usually for passage of an artery, vein, and/or nerve. Foramen cecum. Shallow, pit-like depression on tongue, just posterior to the sulcus terminalis, indicating the opening of the embryologic thyroglossal duct. Fordyce granules. Ectopic sebaceous glands incorporated into the vestibular mucosa during development. Frontal plane. Coronal plane. A vertical plane at right angles to the sagittal plane. Ganglion. An accumulation of neuron cell bodies outside the central nervous system. General somatic afferent. Sensation traveling to the central nervous system from the body. General somatic efferent. Motor innervation from the central nervous system to the skeletal muscles. General visceral AWerent. Sensation traveling to the central nervous system from the viscera. General visceral efferent. Motor innervation from the central nervous system to the smooth muscles of the viscera. Gingiva. The gums. Specialized mucosa overlying the alveolar bone of each dental arch. Glands of Blandin none. Minor salivary G1 ands iocated on either side of the lingual frenulum. Glands of von Ebner. Minor serous salivary glands that empty into the valate papillae. Glaucoma. Condition of increased pressure in the anterior chamber of the eye. Glossopharyngeal nerve. Ninth cranial nerve. Gray matter. Region of the central nervous system consisting mainly of cell bodies. Gray rami communicantes. Unmyelinated fibers, postganglionic, entering spinal nerve from a sympathetic ganglion. Groove. A linear depression on a bone housing a structure. Gross anatomy. Macroscopic anatomy. Study of the body with the unaided eye. Gyrus. Convoluted elevation of the cerebral hemispheres, bounded by sulci. Histology. The study of tissues. Used interchangeably with microscopic anatomy. Horizontal plane. Transverse plane. A plane passing through body at right angles to the sagittal and frontal planes. Hyaline cartilage. Type of cartilage found on articular surfaces of bones. Forms a template for endochondral bone formation. Hyoid arch. Second pharyngeal arch giving rise to the muscles of facial expression, in addition to some other structures. Hypoglossal nerve. 12th cranial nerve. Hypophysis. Pituitary gland. Inferior. Tailward or caudal. Inferior cervical ganglion. Inferior-most ganglion of the cervical sympathetic trunk. Located at the level of the 7th cervical vertebra. Infrahyoid muscles. Strap muscles. Several muscles attached to the inferior aspect of the hyoid bone. Infratemporal fossa. A region inferior to the zygomatic arch and deep to the mandible. Insertion. Site on the bone or in skin where the muscle inserts. Internal. Closer to the center of the body. Intermaxillary segment. Merged medial nasal prominences that gives rise to the bulb and columella of the nose, medial portion of the upper lip, anterior palate with the 4 incisors, and a portion of the median nasal septum. Intramembranous bone formation. Type of bone development within mesenchyme and without a cartilaginous model. Intrinsic muscles of the eye. Smooth muscles located within the eyeball, responsible for accommodation and pupil size. Intrinsic muscles of the tongue. Your muscles wholly within the tongue, responsible for altering its shape. Investing fascia. Superficial layer of the deep cervical fascia. Involuntary muscle. Smooth or non-striated muscle and striated cardiac muscle. Contraction occurs without conscious control. Iris. Colored, anteriorly placed portion of the intermediate tunic of the eye. Isthmus faucium. Oropharyngeal isthmus. Ugulotogastric lymph node. A large lymph node of the deep cervical chain located between the posterior belly of the digastric muscle and the internal jugular vein. Jugulo-omohyoid lymph node. A large node of the deep cervical chain located near the intermediate tendon of the omohyoid muscle. Kieselbach area. Antero-inferior region of the nasal septum, a common site of nosebleed. Labial commissure. Lateral connection of the upper and lower lip. Labial frenula. Folds of tissue attaching the lips to the gingiva. Labial glands. Minor salivary glands located in the mucosa of the labial vestibule. Lacrimal puncta. Orifice of the lacrimal canaliculus located on each eyelid, in the vicinity of the medial commissure. Lacuna lateralis. Meninx-lined depressions on either side of the superior sagittal sinus. These house the arachnoid granulations. Lambdoidal suture. A suture of the skull separating the occipital bone from the parietal bones. Lamina. A flat membranous or osseous plate. Langer lines. Cleavage lines in skin used in surgery. Laryngeal pharynx. Most inferior region of the pharynx surrounding the larynx. Lateral. Away from the midline of the body. Lingual frenulum. Tissue fold attaching the ventral surface of the tongue to the floor of the oral cavity. Lingual tonsils. Tonsillar tissue located on the base of the tongue. Lymphatic ring of Wald-Eyre. Clumps of lymphatic tissue surrounding the oropharynx. Lyn-pH nodes. Filtering bodies located along the lymphatic vessels. Lymphocytes are also propagated here. Macroglossia. Large tongue. Macroscopic anatomy. Study of the human body with the unaided eye. Mandibular arch. First pharyngeal arch to form, which gives rise to the maxilla and mandible among other structures. Mandibular fossa. Glenoid fossa. A concavity in the temporal bone that is the area of articulation with the mandible. Mandibular torus. Bony exostoses on the lingual aspect of the mandible, protruding into the floor of the oral cavity proper. Masticator compartment. A fascia-enclosed space on the lateral aspect of the face, containing the muscles of mastication. Maxillary process. Superior most developing segment of the mandibular arch in pharyngeal arch formation. Meatus. A passageway or tunnel in bone. Meat uses. Tunnels deep to the turbinate bones of the nasal cavity. Mechal cartilage. A cartilage developed in the mandibular arch that later nearly disappears. Medial. Toward the midline of the body. Median lingual sulcus. A shallow groove on the dorsum of the tongue. Median plane. Plane passing through body from anterior to posterior through the midline. Midsagittal plane. Median rhomboid glossitis. An area devoid of papillae on the dorsum of the tongue. Medulla. Medulla oblongata. The caudal-most portion of the brain stem. It contains the fourth ventricle. Meninx. Meninges, plural. Membranes covering the central nervous system, the dura mater, arachnoid, and pia mater. Meniscus. Articular disc. Disc intervening between the mandibular condyle and the temporal bone. Mental symphysis. Mandibular symphysis. Area of fusion of the right and left halves of the mandible. Mesencephalon. Midbrain. A short segment of the brainstem located between the diencephalon and the pons. It contains the third ventricle. Mesial. Term used to describe relative positions of teeth nearest the midline, anteriorly. Metencephalon. Part of the brainstem between the mesencephalon and myelencephalon surrounding the cerebral aqueduct. Metopic suture. An inconstant suture, which may persist, between the developing halves of the frontal bone. Microglossia. Small tongue. Microscopic anatomy. Specialized study of cells, tissues, and organs of the body using a microscope. Middle cervical ganglion. A small, inconstant cervical sympathetic ganglion located at the level of the sixth cervical vertebra. Mid-sagittal plane. Median plane passing through the body from anterior to posterior through the midline. Minor salivary glands. Small salivary glands located in the oral, palatal, and lingual mucosae. Motor end plate. An axon terminal that participates in the formation of a myoneural junction. Mucogingival junction. A sharp, scalloped line separating the gingival mucosa from alveolar mucosa. Muscle fascicle. A bundle of muscle fibers surrounded by perimysium. Muscles of facial expression. Muscle mass developed in the second bronchial arch. These muscles arise in hypodermis or on bone and insert into the dermis of the face, scalp, and neck. Muscles of mastication. 4 muscles responsible for masticatory motions, the masseter temporalis, external pterygoid, and internal pterygoid. Muscular triangle. One of the subdivisions of the anterior triangle of the neck, bounded by the sternocleidomastoid and superior belly of the omohyoid muscles and the midline of the neck. Nasal septum. Vertical midline structure of the nasal cavity, composed of the perpendicular plate of the ethmoid and vomer bones along with cartilage. Nasopharyngeal tonsil. Tonsillar tissue located behind the lip of the auditory tube on the posterior pharyngeal wall. Nasopharynx. Most superior region of the pharynx, ending inferiorly at the soft palate. Neuroanatomy. The specialized study of the structure and function of the nervous system. Neuron. Specialized cell of the nervous system able to perceive stimuli and conduct them along its processes. Neurovascular bundles. Nerves and vessels traveling together, enwrapped in connective tissue. Nodose ganglion. Inferior ganglion of the vagus nerve. Notch. A greatly depressed region on a bone functioning as a passageway. Nucleus. An accumulation of neuron cell bodies within the central nervous system. Occipital triangle. One of the subdivisions of the posterior triangle of the neck, bounded by the inferior belly of the omohyoid, sternocleidomastoid, and trapezius muscles. Oculomotor nerve. Third cranial nerve. Olfactory bulb. An extension of the olfactory tract located on the cribriform plate of the ethmoid bone. It receives olfactory filaments. Olfactory nerve. First cranial nerve. Optic chiasma. Region of decussation of the 2 optic nerves resting on the chiasmatic groove of the sphenoid bone. Optic nerve. Second cranial nerve. Oral cavity proper. Area internal to the dental arches. Origin. Site on a bone from which muscle arises. Oropharyngeal isthmus. Posterior boundary of the oral cavity. Muscular aperture guarding pharynx. Oropharynx. Middle portion of the pharynx, extending from the soft palate to the larynx. Ossicles of the ear. 3 small bones of the middle ear, the malleus, incus, and stapes. Otitis media. Infection of the middle ear cavity. Palatine torus. Bony exostoses of the palate, protruding into the oral cavity. Palpebral fissure. Space between upper and lower eyelids. Panniculus adiposus. Areas of the body containing large deposits of fat in the superficial fascia. Paranasal sinuses. 4 mucosa-lined cavities in the bones of the face. They communicate with the nasal fossae. Parasympathetic nervous system. Division of the autonomic nervous system originating in the brain and sacral spinal cord. This system returns the body to homeostatic state. Parotid fascia. Cranial continuation of the investing fascia that encloses the parotid gland. Parotid papilla. Opening of the parotid duct, Stenson duct, in the buccal vestibule opposite the second maxillary molar. Passivant bar. A ridge of tissue on the posterior wall of the pharynx, representing the contact zone between pharynx and palate when the pharynx is sealed off. Peripheral nervous system. the portion of the nervous system located outside the skull and vertebral canal, and including the 12 pairs of cranial nerves and the 31 pairs of spinal nerves. Pharyngeal arches. Bronchial arches. Bulging bars of mesoderm observed in the head/neck of the developing embryo. Each gives rise to certain structures. Pharyngeal clefts. Bronchial grooves. Grooves on the surface of the developing head/neck region of an embryo between the pharyngeal arches. Pharyngeal pouches. Bronchial pouches. Outpocketings of the pharynx during development. Pia mater. Innermost delicate layer of the meninges covering the brain and spinal cord. Posterior. Back of the body. Posterior triangle, triangular area of the neck, bounded by the sternocleidomastoid and trapezius muscles and the middle 1/3 of the clavicle. Postganglionic. Visceral motor neurons whose cell bodies are located in one of the autonomic ganglia. Preganglionic. Visceral motor neurons of the autonomic system that have not yet synapsed in one of the autonomic ganglia. Pretracheal fascia. Deep layer of the deep cervical fascia surrounding the viscera of the neck. Pretrached fascia. Deep layer of the deep cervical fascia enveloping the vertebrae and the deep cervical muscles of the neck. Principal lymph node of the tongue. A large lymph node of the deep cervical chain, responsible for draining the tip of the tongue and the region of the lingual frenulum. Protrusion. A motion that juts away from its normal resting place, such as the motion possible with the mandible. Proximal. Closer to the origin. Pterygopalatine fossa. Small, pyramidal space enclosed by the maxilla, sphenoid, and palatine bones. Pupil. Circular orifice in the middle of the iris through which light enters the eye. Rathke pouch. A diverticulum of oral ectoderm in the roof of the developing oral cavity, destined to give rise to a portion of the pituitary gland. Reflex arc. The simplest form of functional neurologic pathway, bypassing many connecting neurons. Regional anatomy. Study approach in which individual anatomic regions of the body are considered as units. Reichert cartilage. A cartilage developed in the second pharyngeal arch that later becomes obscured. Retraction. A motion that causes a structure to be drawn back, such as the motion possible with the mandible. Right lymphatic duct. Major vessel of the lymphatic system delivering lymph to the right subclavian vein. Rods. Light-sensitive cells of the retina concerned with vision in dim light. Rostral. Cephalad. Toward the cephalic, head, end of the organism. Rotation. To move about an axis. Rotatory motion. One of the motions possible at the temporomandibular joint, involving the mandibular condyle and articular disc. Sacral outflow. Parasympathetic outflow to the viscera of the pelvic region from the sacral spinal cord. Sagittal suture. A suture of the skull, located in the midline, that separates the parietal bones. Sclera. White of the eye. Sesamoid bones. Bones developed in tendons, providing extra leverage or reducing friction at the joint. Coelography. Radiologic examination of salivary glands and their ducts subsequent to introduction of a radio-opaque dye. Sinusitis. Inflammation of the mucosa of the paranasal sinuses. Special somatic afferent. Sensation traveling to the brain from the special senses of vision and hearing. Special visceral AWerent. Sensation traveling to the brain via cranial nerves from the special visceral senses of taste and smell. Special visceral efferent. Motor innervation from the brain via cranial nerves to the muscles of branchiomeric origin. Sphenomandibularus muscle. A newly discovered muscle of the deep face, originally believed to be a portion of the deep temporalis muscle. Recent careful dissections have demonstrated it to be a separate entity with its own vascular and nerve supply. It is believed to assist in mastication. Stellate ganglion. Fused inferior cervical and first thoracic sympathetic ganglia. Stenson duct. Parotid duct. Striated muscle. Skeletal muscle. Voluntary muscle. Subarachnoid space. Space between the arachnoid and pia mater, containing the cerebrospinal fluid. Subclavian triangle. One of the subdivisions of the posterior triangle, bounded by the inferior belly of the omohyoid muscle, the sternocleidomastoid muscle, and the middle one-third of the clavicle. Subcutaneous connective tissue. Hypodermis. Loose, connective tissue deep to the dermis. Superficial fascia. Subdural space. Potential space between the dura mater and the arachnoid layers of the meninges. Sublingual caruncula. Opening of the submandibular duct at the base of the lingual frenulum. Submandibular triangle. One of the subdivisions of the anterior triangle of the neck, bounded by both bellies of the digastric muscle and the inferior border of the mandible. Submental triangle. The only unpaired subdivision of the neck. It is bounded by the anterior bellies of the digastric muscles and the hyoid bone. Suboccipital triangle. A triangular area in the back of the neck, circumscribed by three muscles, rectus capitis posterior major, obliquus capitis superior, and inferior. Sulcus. 1. A depression on the bone housing a structure. 2. A depression or groove located between gyri on the surface of the cerebral hemispheres. Sulcus terminalis. A posteriorly directed, V-shaped groove separating the anterior 2/3 and posterior 1/3 of the tongue. Superficial. Relative position near the surface of the body from any respect. Superficial cervical lymph nodes. Chain of lymph nodes aligned along the external jugular vein. Superficial fascia. Subcutaneous connective tissue deep to the dermis. Superior. Toward the head, or cranial. Superior cervical ganglion. The superior-most ganglion of the cervical sympathetic trunk, located at the level of the second and third cervical vertebrae. Superior laryngeal aperture. The superior inlet of the larynx. Suture. A type of fibrous joint found in bones of the skull. Sympathetic nervous system. Division of the autonomic nervous system originating in the thoracic and first few lumbar spinal cord segments. The system prepares for fight or flight. Sympathetic trunk. The sympathetic chain ganglia and their connections. Symphysis. A cartilaginous bony joint between two continuous bones. Synapse. A place where a neuron cell communicates with another cell. Synchondrosis. A temporary cartilaginous joint that will be ossified later. Syndesmosis. Bony joint with fibrous connective tissue union permitting little movement. Synovial fluid. Fluid produced within the synovial sheath to bathe the muscle tendon joint and bursa, thus reducing friction. Synovial joint. A bony joint surrounded by synovial cavities. Synovial sheath. A sac-like covering over a muscle tendon or joint, producing synovial fluid to bathe the tendon and joint, thus reducing friction. Systemic anatomy. Study approach in which each system of the body is considered separately. Temporal fossa. A depression on the lateral aspect of the skull, containing the temporalis muscle and its fascia, vessels, and nerves. Tentorium cerebelli. Meningeal reflection of the dura mater, intervening between the cerebellum and the occipital lobe of the cerebrum. Terminal ganglia. Parasympathetic ganglia usually located very near the viscera or glands to be innervat. Thalamus. Largest portion of the diencephalon. Functions to relay sensory impulses to the cerebral cortex. Thoracic duct. Major vessel of the lymphatic system delivering lymph to the left subclavian vein. Thoracolumbar outflow. Region of spinal cord from which sympathetic system originates. Thyroglossal duct. Remnants of the embryologic origins and migratory path of the tissue destined to be the thyroid. Tracheotomy. A surgical procedure whereby an incision is made in the anterior aspect of the trachea to provide an airway passage to relieve dyspnea. Translatory motion. One of the motions possible at the temporomandibular joint, involving the temporal bone and the articular disc, a sliding motion. Transverse plane. Horizontal plane at right angles to sagittal and frontal planes. Trigeminal nerve. Fifth cranial nerve. Trochlear nerve. Fourth cranial nerve. Turbinate bones. Conchae. 3 mucosa covered, scroll-like bones on the lateral nasal wall jutting into the nasal fossa. Tympanic plexus. Plexus of nerves derived from cranial nerve 9 and the sympathetic plexus. It serves the mucous membranes of the middle ear. Tympanum. Middle ear cavity, also eardrum. Vagus nerve. 10th cranial nerve. Valate papillae. Circumvallate papillae. A row of large, mushroom-shaped papillae anterior to the sulcus terminalis on the tongue. Venous pterygoid plexus. A venous P1 axis receiving tributaries from many areas of the head. It is located between the temporalis and the pterygoid muscles. Venous sinus. Large, venous channel not possessing the normal histologic complement of veins. Ventral. Equal to anterior but usually reserved for quadrupeds. Ventral horn. Gray matter of the spinal cord, containing motor neurons. Ventral root. Motor axons exiting the ventral root of the spinal cord. Vermilion zone. Red area of the lips. Vestibule. Cleft or space between lips and cheeks and the teeth and gingiva. Vestibulocochlear nerve. 8th cranial nerve. Vidian nerve. Nerve of the pterygoid, Vidian, canal. It is composed of the greater petrosal nerve, of cranial nerve 7, accompanied by the deep petrosal nerve, of the carotid plexus, as they pass through the pterygoid canal. Vocal cord. A fold of mucous membrane on the lateral wall of the larynx, responsible for the formation of sound. Voluntary muscle. Striated or skeletal muscle. Contraction occurs by conscious control. Wharton duct. Duct of the submandibular gland. White matter. Region of the central nervous system consisting mainly of fiber tracts. White rami communicantes. Myelinated fibers, preganglionic, connecting spinal nerves with the sympathetic ganglion. Wormian bones. Additional bones that may be found in suture lines of the skull. Zygomatic arch, malar arch. The arch formed by the temporal process of the zygoma and the zygomatic process of the temporal bone.